So with the data, again, the first step was to drive that immediate prescription and prepare the referral pathways. We needed to identify where the patients were currently cared for, and we did that before we launched. We knew where the patients were, but we also had to identify where the future prescribers were based on their diagnosis and prescription code-driven profiles. But because we were new in this space, we had to develop an analog. So what would a pediatric endocrinologist, for example, look like that would be willing to prescribe and prepared to prescribe this drug? Because we couldn't expect that all pediatric endocrinologists would prescribe. So that's where we use the data selectively to identify those prescribers, potential prescribers, and begin to educate them about the condition ahead of time and categorize them to determine if we should be getting to them when drug launched and helping the patients find them. And the data also good data helps us to understand existing referral patterns so that we don't have to figure that out on our own. And then when the time's right, it's important to be agile and know when to pivot here. We needed to go deeper to find the patients now. In the first few months of launch, in our case, we could rely on that pent-up demand and patients finding their way to treatment very quickly. But over time, you realize you have to start going deeper to find patients who may not be aware, may not be as educated. And that's where a more targeted digital plan specific to customers can be helpful. And if you have good data with the right permissions, you can do list matches and target customers, HCPs, and even patients with the information that you need so that you're not spending your media dollars or your promotional dollars unnecessarily. You can be targeted. And finally, you can use some of this data analytics to even predict physician interest in learning about rare conditions and at the right time. And that's something we're digging deeper into now and eager to see how that looks. But I just want to say that this is being incredibly focused, categorizing physicians into, how you need to reach them, and at the right time is critical. And the theme here is really just focus and prioritizing.